A lot of times nurses do identify these patients potentially, but then don't know where to go from there. So it's equally important to know the response as it is to recognizing them.
Having the context and better understanding all of the nuances around lack of disclosure and lack of self-identification, how the systemic root causes can lead to trafficking, can really make us see a bigger picture so that we're taking into account more than just what we're seeing in that room, but also taking a really deep history on the patient and better understanding all of the context with which they're coming to us.
So it's important that there's not only an initial human trafficking training for healthcare providers, but ongoing training. But then also taking it a step further and having a protocol in place is so important so that other healthcare providers, even if they haven't been to a training recently, can easily pull up a protocol, a procedure, or a guideline and know exactly what the response should be. And that also ensures that regardless of which healthcare provider the patient sees, they're going to get the same approach and the same response. Because we certainly don't want these patients to fall through the cracks based on which healthcare provider they see.
The Laboratory to Combat Human Trafficking, in conjunction with the Denver Anti-Trafficking Alliance, created a protocol recommendation toolkit for healthcare providers here in Colorado. That toolkit can be accessed on either of our websites. It may be as simple as notifying your supervisor or calling the hotline, but it should also include mandatory reporting requirements, any kind of HIPAA concerns or questions around HIPAA. It should also include red flags and behavioral cues, community resources, and also ways to frame these often challenging conversations.
In my 20 years of working with patients that are affected by violence, I'm most proud of those small connections and wins that we've had with patients that I feel, had they gone somewhere where there were healthcare providers that weren't trauma and violence informed, their outcomes could have been very different.